Hi, everybody. I wanted to take a moment here to talk about active myofascial mobilization, the advanced technique. So, this is part two of the myofascial mobilization series. So, in myofascial mobilization, we explored all the passive techniques and we got into our postural assessments and anatomy of fascia. Now, we're going to be taking that a step further for sure. And so, this course is based on structural integration and myofascial principles. Our lectures are going to focus on advanced musculoskeletal joint movements and also advanced musculoskeletal joint anatomy and their relationship to posture at different regions of the body. For instance, the neck, shoulder, spine, hip, knee, and ankle, we're going to be taking a look at. And so we're going to be wanting to explore different approaches to working with our patients, and that's going to be the active work. So, with the active work, our patients are going to be active participants on the table. So, we're going to get them moving as we're doing our release work. And this is going to also work with their neuromuscular system. So, as we're releasing, let's say, the knee, the posterior capsule of the knee, we're going to have them moving. And so we're going to be working with some corrective neuromuscular pathways, and we are going to be looking to open up those pathways and looking for correct joint movement as we're opening up those pathways. So really a great interaction with our patient, their nervous system, their fascial system, and their muscular system. Really exciting stuff. So this is going to make your work more effective and also easier and more efficient. And so you're going to be more efficient. You're going to be working with greater ease, which means that you're going to be able to increase your patient capacity. So you're going to have less fatigue as you're working. So you're going to be able to see more people each day. You're going to have more patient success, increased patient success stories by doing this work, which in turn is going to be increasing your cash flow because now we're going to be seeing more patients and we're going to have more patient referrals. So what we're going to be also going over within this course, just to review, we're going to be going over advanced kinesiology. We're going to be going over advanced postural assessments, looking at each one of those different regions and the joint movements and the very small particulars of those joint movements. We're going to be we're going to be viewing that on each other and then taking that relationship to the table and working on it. We're also going to be looking at some exercise that we can incorporate into our routines and also some movement assessments as well. For instance, we're going to be getting into a little bit of gait assessment within this course. We're also going to be getting into treatment planning, which is going to be very important for looking at how many sessions you may need to be doing with your patients. Is this going to be 3 or 4 sessions? Is this going to be closer to maybe 6 to 8 sessions, 8 to 10 sessions that you're going to need to be talking about with your patients as you're doing goal setting with them with that first treatment as they walk, once they walk in the door, we want to do a subjective, we want to do assessments, we want to then get into looking at the goals of what they're looking for and what we see as far as moving forward. We're also going to be getting into some different techniques, for instance, spiraling techniques, looking at different rotations in the body and how to unwind those spirals. We're going to be taking a look at side lying techniques, having our patient on their side and accessing the medial and lateral lines of their body. We're going to be taking a look at seated techniques where they're going to be seated. We're going to be calling for movement and we're going to be doing some great release work in great efficient ways on their body. So I just wanted to make a note that this course is open to anybody that's taken the myofascial mobilization part 1, and if you get permission from me. So let's say you've already done somebody else's myofascial course and then you want to jump in on this one. So this course does have a bit of a prerequisite, and this is a 6-day program, and the 6 days are going to be dedicated to the lower leg, the pelvis, the back, the shoulder, the neck. And then our 6th day is going to be dedicated to treatment planning and starting to put the whole body together. So if you're interested in this course, get in touch with CATA, nyc.com, and go to their structural integration tab and sign up for this course. I really look forward to seeing you guys there. Take care.